Hello and welcome back to Visions for Health. I'm Wendie Trubow and my guest today is Sophia DaRosa-Spillane, nurse practitioner at Visions Healthcare. Sophia, welcome.
Hi,
Thanks for being here.
Thanks for having me here.
So we're going to talk about allergies today. And you have a long history in allergies. How did you get started in doing allergy evaluations?
Well, first of all, I've had allergies all my life, so it was kind of serendipitous that I ended up learning a lot more about allergies because I've always been sniffly. I've had people call me Sneezy, like from the Seven Dwarfs, because I was always sneezing.
Lovely. So that was your nickname?
Yes.
Okay. I won't call you that.
Thank you. And, you know, as I was trying to find an area in which I felt comfortable in, I came across a center that needed a nurse to work in the allergy department. And I thought, hey, that sounds like a great experience. So I started off allergy testing and counseling patients on allergies. And that's where it all started.
So how would someone know that they have allergies?
That's a really good question. Sometimes symptoms can be very obvious, as the commercials show. I mean, people are sneezing, it's seasonal pollens like a tree or grass, and people note that they all of a sudden are having these symptoms. But sometimes allergies can be a little bit more vague, and they can come across in postnasal drip. They can come across with itchy skin or several different skin conditions. Mm-hmm. They can affect your energy level. You can feel a lot of fatigue and not a lot of other symptoms. Because
are headaches an allergy?
Headaches can actually definitely be because of an allergy.
Okay.
So
clearing throat?
Clearing the throat, postnasal drip, cough. Yeah. Allergies can exacerbate conditions like asthma. And even inflammatory conditions, because allergies can increase inflammation in the body. So
there's lots of possible symptoms that people could have.
Absolutely.
Do you have to have more than one?
That's another good question. You know, I guess if your symptom is causing quality of life issues with you, if it's a cough or a clearing of the throat or itchy skin, and it's affecting your everyday life, then absolutely, you can have one symptom and get treated.
Okay. How rare is it that people have, I mean, is one symptom typically all people have, or do people usually have a few?
I find that people tend to have a few, but they may focus or like really hone in on one symptom that tends to crop up more or interferes with a job or just daily, like day-to-day life. So when we do an intake with them, which is what happens when you do an allergy test or when you see someone, you'll find that there are other symptoms that could be affected by their allergies, and people just weren't really aware of that.
I think what's hard is if it creeps up on you slowly, and that's just the way your life was, you might not think about it as a problem.
Definitely. And people tend to deal with a lot of chronic issues and just accept it as like their baseline of life. Mm-hmm. And as long as they can get up and go, then they don't really think about it. But when things start to become a problem, then they start looking for answers. And a lot of times we can kind of address these issues earlier on if we see signs and symptoms.
So you mentioned seasonal allergies. Are there other things people can be allergic to?
Oh, absolutely. So there are a lot of indoor types of allergies: dust mites, dander, pet dander, and molds. Those are some of the top allergens that people may experience throughout the year, regardless of seasonal changes.
So pet dander, I'm going to stay away from pet dander for the moment.
Okay.
I'll come back to it. Talk to me about dust mites. You know, my house is clean. I have hardwood floors. How would I have dust mites in my house?
Well, you know, you're right. Hardwood floors is a big thing. When people have rugs, it can hold on to dust. Okay. Furniture can hold on to dust. So upholstered furniture, we may not think of it, but it can hold on to a lot, including dander. And if you don't clean your upholstered furniture, it can hold on to it, and just sitting on it will release dust and potentially molds in the air.
Oh, this doesn't sound good. Is there some recommendation for how often someone should clean their upholstered furniture? And when you say clean, do you mean like steam clean, or do you mean just wipe it down?
You know, it's variable. If you live in the Northeast and we have heat on all of the time, and then you have like you have children that are bringing in things. You would know a little bit about that.
Yes.
So it really depends on the quality, I feel, in the home to start off with, and what's going on in the house. So people with a lot of pets, people with a lot of kids, people with a lot of exposure to allergens, heating systems that perhaps haven't been cleaned out regularly, their house is going to have a lot more allergens, and potentially things like upholstered furniture will hold on to it, and you will, breathe that stuff in at some point.
Are dust mites in our bed too?
Absolutely.
Is this the good news and the bad news?
Good news.
It's fixable?
It's fixable. It's pretty well known from some of the commercials out there that, after a certain amount of time, dust mites live in mattresses, and they breed and feces. I'm just trying to find the right words here. But it's basically a living environment for the dust mites. You don't have to be a dirty person to have dust mite. It happens over time. So we say around 10 and 15 years of having a mattress, your mattress probably has increased in weight by half, I've heard, because of all of this extra. So, and you're breathing that stuff in. If getting a mattress isn't an option for you right away, then covering your mattress with like a plastic cover, and not just the top cover, but encasing it completely like a Ziploc bag, is what will help be a barrier.
Okay, so you just said that 10 to 15 years is probably a good amount of time to get rid of a mattress because of the growth of the dust mites?
Probably even sooner for support purposes as well, and I'm just I believe, dust mites can be an issue way before then. So encasing your mattress will help prevent this accumulation, and then laundering of your bedding is also helpful, bedding and sheets.
Okay, this is probably very rich here. So is there a type of mattress that dust mites will not grow in or will be inhibited in?
So there's lots of mattresses out there, and it's a question, I have to be honest, it's a question I get a lot. And a lot of products will make claims, dust mite resistant. I can't speak to those claims. What I do know is that, generally speaking, using an encasing will prevent that proliferation or that growth of dust mite to happen. Okay. So I don't know that I can recommend a particular brand. I don't know if I should even, but generally covering it will be generally a good practice. Okay,
so so when you're looking for something like this, I love to shop online. Do I Google mattress allergy cover? Is that what I would look for?
Yeah, you can Google it. I'm sure you can find it online. A lot of the department stores carry it. Okay. People worry about getting the top brand. I feel like just buying some kind of barrier is important. You don't have to worry about spending a lot of money. Okay. One thing that people would really be helpful for people to realize is if they suspect that they have a dust allergy or dust mite allergy, feathers harbor dust mites. So if you have feather pillows or comforters, it's something that you may want to consider.
So can you get a cover for your pillow too?
You can.
Okay, so a cover for your pillow, a cover for your mattress. Get rid of your down, you just said get rid of your down comforters, your down pillows, and replace your mattress as frequently as you can afford to.
Probably, yeah.
Oh, okay. And how would someone be able to identify, oh, I'm reacting to my bed or sleeping? Is there some way people would know?
A lot of times individuals that have symptoms when they wake up in the morning. So one thing that we help do when people come in for a consult and they get tested is we try to find patterns in the symptoms that they're having. And when people say, boy, I can't seem to sleep well at night, and when I wake up I'm really congested and I'm itchy or other symptoms, you have to think about where the patient has been and the potential that the environment is probably affecting them.
Okay, so that would be a key. If they say, I wake up, I'm congested, I'm coughing, I don't sleep well, I'm itchy, then you say, oh, your bed?
Yeah, then we kind of do a survey of their environment. Do they have rugs, curtains? Do they feel symptomatic if they're watching TV in their bedroom? Is it just when they wake up in the morning? And then I have people can be very attached to their down comforters and pillows. I'll tell them to trial and maybe use different pillows and see if they notice a difference, and just kind of explore options.
I heard silk is anti-mite or mite inhibitory. I don't know if that's true.
You know, I remember hearing something about that.
Like there's silk-filled comforters that are cheaper than down, actually.
I can't speak to that, but I do remember hearing something about that.
Okay, so let's talk about animals, because people love their animals.
Yep.
What happens when an animal sleeps with you?
Well, I'd like to comment that people would more readily give up their nurse practitioner, doctor, and allergist before they give up their pet, which makes sense because
so the
they
pet
become parts
isn't
of our
negotiable.
family. Yeah.
Okay, so the pet's not negotiable. How can people minimize their exposure and their reaction?
Those are great questions. Depending on the type of animal you have, typically animals with hair tend to be less allergenic. They're dander. However, animals do bring in stuff from outside.
Can I stop you for a second?
Sure.
There's animals who have hair and versus what?
Like fur.
Okay, so how would I know my animal has hair or fur? Is this like does the pet
It's not
store
my
tell us?
specialty. Yeah, poodles. I think Shih Tzus. There are certain animals that have more hair-like, and they tend to be certain types of breeds that people hear about when they're buying an animal. If they're short-haired kind of animals that kind of leave their hair everywhere, that's not fur. It's typically not hair. It's usually softer in texture if you were trying to figure it out yourself, a little longer, a little softer.
I'll bet the internet would be a good source for
Yes.
this one. Okay, so people should buy animals if they're prospectively looking that have hair, not fur. Interesting. Okay.
But some people will come in and they'll say, I have allergy symptoms, but it's not my pet because I have a hypoallergenic pet. Which brings me back to the fact that animals do come into contact with other allergens, pollens, molds, and dust mite, and they can very conceivably bring that stuff into the home, onto your bed, onto your couch. So in order to offset that, grooming your pet regularly is helpful. And not in your bedroom or in your living room, but maybe outside or in a hallway, somewhere outside of the living area. And groom them pretty regularly so that you're making sure that they're not bringing all that stuff into the house.
Okay. And then do you tell people not to let the dog or cat or whatever else it is sleep in their bed?
We oftentimes recommend that patients, people that come to see us, not let their pets into the bedroom. It's hard to do when you have an animal that's older and they're used to it. But definitely if you're considering getting a pet, you want to establish these behaviors early on so that it becomes something that you don't have to worry about in the future.
Okay, so no pets in the bedroom, if possible.
If possible, yep.
Encase your mattress, encase your pillow, get rid of down. You mentioned rugs. Are rugs something that hold allergens for people?
Yep, absolutely. Rugs that are installed are a little more challenging because sometimes things spill onto rugs and there can be mold growth, allergens under the rugs that you're not necessarily getting to when you're cleaning your rug regularly. Surface area rugs are great because you can take them out and get them cleaned and bring them back in.
How often should you clean your rugs if you're able to lift them?
If you're able to lift them?
Yeah.
Depending on how quickly you find them to be, I guess the good question is if you have pets in your room, probably more regularly. Wool rugs, there are different types of fabrics that tend to get dirtier or hold on to things a little bit more. So depending on the type of rug and how delicate the rug is, I'd probably consider once or twice a year.
Okay. Yeah. And do you also recommend HEPA filters or any kind of filters in bedrooms or anywhere else in the house?
Absolutely. HEPA filters are helpful, especially if you have symptoms in the bedroom. If you're cleaning your duct systems regularly and you still have exposure to dander, I mean, sometimes we don't have control over where we live. If you're renting an apartment or living in an old home and you're not going to be making any major modifications, whatever you may do as much as you can, but you're not getting rid of all of the allergens. And the bedroom we consider to be a sacred space because it's where you rest for 6 to 8 hours. So your body needs to nurture itself and not be exposed to things that cause inflammation and allergies. So getting an air cleaner can help reduce those allergens in the bedroom as well as doing these other things. So when patients do come in, we do focus a lot of our interventions in the bedroom for this particular reason.
Okay. So then when someone has allergies, when you've ascertained, yep, you have environmental or seasonal, or what about foods? People can have allergies to foods, although probably that's much more apparent because they stop breathing. So, okay, we'll avoid those.
Well, I'm glad you brought that up because a lot of people come in and they think that one thing is causing their symptom. And they'll say, I think it's X, Y, or Z that's causing it, and I just want to be sure. In reality, it's usually a bunch of things that can be causing symptoms, and one of those things could be foods. So there are food allergies, like you discussed, when a child or a person may have an immediate reaction in which, your lips swell or there's breathing issues, your throat swells. Those are serious, immediate type reactions. There are also reactions that your immune system, mediated by the immune system, that are a little bit more chronic and low grade. And you can also have those types of allergies to foods, food intolerances. So oftentimes when you're being evaluated for allergies, we'll ask you about your gut. And we'll ask you about the things that you're eating. And I know it sometimes people are surprised because they don't see the connection between sneezing and what their gut's doing. But quite honestly, food intolerances often contribute and sometimes can be one of the biggest reasons why people are having allergy symptoms.
So can you just talk about the top allergens in terms of foods that people would say? I mean, I know I had a friend who said, oh, I stopped milk and my asthma got better. And I was like, what?
Yep.
And this was probably 20 years ago at this point.
So dairy products are definitely one of the top foods that people can find that they have an intolerance to. Wheat, sugar,
all the
soy,
favorite things.
all those favorite things that are not necessarily something you eat in and of itself, but can be combined with other things. And we like to call those like the hidden food sources. So that's soy, wheat, gluten, dairy. Those are some of the top ones that we'll ask people to eliminate. We can actually do blood testing for it, but sometimes it's more powerful when people eliminate it out of their diets and kind of see the changes that may happen.
Okay, so what happens in the testing itself? There's sort of this mystery, like what happens when you go for allergy testing?
Yep, so when we do environmental testing for allergens, they're broken up into different tests. So there are the year-round allergens that we consider those to be the dust mites, the molds, and the danders. Then there are the seasonal allergies that we break up into spring and fall. Spring tends to be the trees and the grasses, and fall encompasses the grasses as well as weeds. So when you come in for testing, you'll be coming in for one of those 3 tests year-round.
Do you break it up because people just can't tolerate this many allergens in one sitting? Is that?
Yeah, we actually do a lot of different allergens, so it's easier to split them up. We would never do all of them.
That sounds like it would be
time.
a lot of of time and
a lot of pricks.
Okay.
So for the year-round allergen, which we consider kind of the base test because it's showing us reactions to things that you're exposed to most likely every day year-round. We start off with prick testing, which involves just the inner aspect of your arm, and we put a little prick of a little bit of the allergen that's mixed in glycerin and saline, and we put it on the skin to see if there's a reaction. We follow it subsequently with intradermals, which are little bits of the allergen kind of made under, like a little bubble under your skin on your outer arm. Okay. And we'll use both arms. Okay. And people often ask, does it hurt? And that's a very common question, and it's a very good question. Pain is very subjective, and this can be a little anxiety-provoking for some people. But when you compare it to vaccines or injections that you might get, like a flu shot, it really is much less evasive than that because it doesn't go into the muscle, it goes under the skin.
Okay. So it's on the skin, but it's not really deeply injected into the body.
No, it's right under a layer of skin. And our goal is after a certain amount of time, we look to see if the reaction grows. And if it grows within a certain range, then we know that you are reacting to the allergen.
Okay. And then people get their treatment. And do people notice immediately that they feel better?
Well, one of the first things we do is try to see if there is a source of that particular allergen in the home and have them eliminate it. So that's the first step. The second step is treatment. And treatment can result, everyone's so uniquely different. So some people find that treatment can have an improvement in symptoms.
As I have.
She needs your allergy shot. People can have, oh, I lost my train of thought. Let me see.
You said people can have an improvement in symptoms.
They can have an improvement in symptoms. Some people find like very soon. But more often the case, we have people do treatment for a good amount of time, like 3 to 4 weeks before we start to expect them to see symptom relief.
And once they've started allergy treatment, do they go on for 3 to 5 years? Is that typically what happens for people?
Yep. It really depends on the type of treatment and the patient's response to the treatment. And oftentimes when people are incorporating environmental controls so they're identifying sources in their environment and potentially dealing with some food intolerances and the treatment, they find that symptom improvement is a lot sooner.
So there's a lot of factors that go into
There's
this.
a lot of factors, and everyone is a unique little puzzle of what exactly is contributing to the symptoms that patients are having.
So it sounds like people can get a lot better, even just if they're reactive to dust mites. Encasing their bed could
be very, very helpful. Yeah. So it's worth making those alterations and just seeing if that in of itself helps.
Okay. Are there, is this something that's typically covered by insurance for people?
For the most part, a lot of insurances cover allergy testing. However, that's not necessarily the case all of the time. So it's always best to check with your insurance.
Mm-hmm. Especially in early part of the year when deductibles kick in,
right?
right?
Yes, exactly.
And as we come towards the end of our show, is there anything that I missed asking you about? I mean, this is such a rich topic. It seems like we could go on for a long time talking about allergies.
Yeah. This went along a lot quicker than I thought. What I would say to people is don't ignore symptoms when they start happening. Explore environmental factors and potentially, come in and be assessed because the treatment may be a good option for you. A quick thing that people can try to do is take some vitamin C or some natural remedies to see if that can help them if their symptoms aren't chronic and everyday.
Let's talk about that for a minute. There are certain things, you mentioned natural remedies. What are certain things that people can take that might make a difference?
Quercetin and bromelain.
Okay.
These are things that you can get at like natural stores, natural foods. They can help kind of calm down the immune system for allergies. And vitamin C is a really simple antioxidant that kind of acts like an antihistamine. And a lot of people do very well with that. And sinus rinses.
Sinus rinses?
If you do sinus rinses, which is a saline wash or rinse, regularly, you can actually take out the actual allergens from the sinuses. So if you have sinus symptoms, it's a really great thing to do to get those allergens out of the allergens.
So when you say sinus rinse, you're saying put saline up your nose?
You're basically flushing your nose, and you never want to force it.
Okay.
But you're flushing your nose. And it's a matter of leaning forward and you're using distilled or boiled water that's cooled down. mixed with a saline packet, and you're just rinsing your sinuses so that if there are allergens there causing irritation, you're rinsing them out so that they're no longer there causing a problem.
That's very cool.
Yeah, and simple.
And people do this at home, yes?
People do this at home.
They
could do it anywhere, but home is a little more comfortable.
Okay, and are there kits that people buy, or where would someone get something like this?
A lot of pharmacies have kits, and a lot of people recognize the neti pot.
Okay.
And that's where this whole idea stemmed from. Ayurvedic kind of idea of flushing out the sinuses, and it's like a little Aladdin-looking lamp kind of pot. But they do have bottles that are a little more easy to manipulate and use if people aren't too fond of that.
Okay, so there's actually a lot of things people can do.
Oh, there's a lot.
Interesting. Anything else that we've missed? So you mentioned quercetin, you mentioned bromelain, you mentioned vitamin C. So these are all natural. And vitamin C, like the chewable 500 milligrams, or is it more than that?
Buffered vitamin C, which is easier on the stomach. Powder is sometimes a little easier to absorb. There's so many different forms that you can get. And vitamin C can cause a little gastrointestinal distress. So your stomach can feel a little bloated or uncomfortable, and everyone's a little different, so you don't want to take so much that you're feeling that.
Okay. So that would be too much if you
that
had
would be too much.
Sort of a stomach upset afterwards.
Yes.
You say, okay, less next time?
Yes. And people can usually tolerate 1 to 3 grams.
Oh, that's a lot.
Which is a lot. People find that local honeys are helpful. There's a lot of different ways to approach your allergies, and half an hour is a short period of time.
Half an hour is just scratching the surface, it
Yeah.
sounds like. Okay, so you do allergies. Do you also do family medicine or internal?
I do primary care.
Okay.
I'm an adult nurse practitioner, so I see children and adults 15 and older.
Okay.
Obviously, allergies are an interest. I also work on food intolerances in the gut, which I feel like is a very big part of your health. And
that's it. And you do accept insurance?
I do, accept insurance.
This was great, Sophia. Thank you.
Oh, thank you.
Thank you for joining us for another episode of Visions for Health. My guest today is Sophia DaRosa-Spillane, nurse practitioner at Visions Healthcare. Thank you.